Okay, class, we'll continue on to part 2 of the lecture. Now we're looking at the anatomical position. So the anatomical position is a reference to the human body. Make sure you know this. This is in every quiz, every test, midterm. This you'll have to know for the rest of your life. And the reason is we have to find a point of reference when we're talking about a human being. So the characteristics of the anatomical position is standing erect with feet flat, arms at the sides, the arms are supinated, the palms, face, and eyes are facing forward, and provides a constant reference of the body of the position. So if you look at this diagram here, you're seeing that standing erect with the feet flat, arms at the sides, supinated, palms facing forward. This is the key characteristics because in the fundamental position, the palms will be facing towards the body, and I'll show you an image of that. Okay, but whether the patient is supine, side-lying, on their stomach, which is prone, it doesn't matter. You always refer to someone in this anatomical position. Okay, so you never look at this person and say, well, my right and his left. No, it's always this anatomical position. Okay, so the liver is always on the right side. The stomach is always on the left side. You don't reference it because you're looking at them this way. This is the reference that you always give. Okay, now the fundamental position, if you look at it, pretty much the same, but look at the palms. Okay, the palms are facing towards the body. That's the difference between the anatomical position and the fundamental position. Most of you stand in the fundamental position, but when we're referring for human anatomy, we always refer to the anatomical position. Make sure you know that for the practicum. Make sure you know that for the rest of your life. Okay. Now, here are some regions of the body that we talked about earlier, but you should definitely know all these regions, and you can make flashcards. These are really good things that you should know. Direction terms apply to the human body. Well, cranial is towards the head, caudal is toward the tail, anterior is ventral, posterior is dorsal. Okay, the right and the left. Make sure you know that lateral is towards the outside and medial is towards the midline. Proximal is closer to the trunk and distal is away from the trunk. Okay. The 3 planes most commonly used in the anatomical and medical imaging are sagittal, frontal, and transverse. So make sure you know these. Now the planes are different than the axes. So the sagittal plane, that's the sagittal plane. You have the transverse plane, and then the frontal plane. Okay. So I had mentioned this earlier in the lecture here. So sagittal will divide you into right and left. The frontal plane will divide you into anterior, posterior, and the transverse will superior and inferior. Now the transverse plane doesn't have to be here. It can be up here. It can be anywhere. But as far as these cuts are concerned, then you'll be able to understand it when you're looking at imaging. Okay, so a transverse plane, you could be able to see the heart, the lungs, the brain, but you can also see a cut of the brain, the lungs, and the heart in a frontal plane. The sagittal plane, you have to be careful because if it's down the middle, you might only see the liver on one side and the stomach on the other, depending on where the cut is. So if you wanted to see a full body image, which would include the heart, the lungs, and all the GI tract, then the frontal plane would be a good image. Okay, so that might be a good quiz question. Use the frontal coronal plane to see the entire abdominal continents. Not continents, contents. Alright, so here's another reference point, anterior, posterior, medial, and lateral. So getting used to this medical terminology is very, very important. Alright, so this is a great little section. Pretty much you need to memorize this. These are good true or false questions or multiple choice questions on a quiz. Again, if you listen to the lecture, if you listen to our class meetings, I will guide you in the right direction as far as what to study. Now remember, the humerus is always the humerus, the femur is always the femur, so you have to know that. I can't really change that. But instead of just pure memorization, you want to understand the concept of where it is in the body, what does it do, so all that stuff, instead of just pure memorization, apply it. Ask the question, where is this in the body? What does it do? What would happen if something were to be injured? Okay, so learning it that way is very, very important. Okay, anterior toward the front of the body, posterior toward the back of the body. So here's a good example. The sternum is anterior to the heart. Posterior, the esophagus is posterior to the trachea. Ventral, toward the anterior side, so the abdomen is the ventral side of the body. Dorsal, toward the posterior side, that's the scapula, or dorsal, posterior, behind to the rib cage. Superior above, of course, the heart is superior above the diaphragm, or superior to the diaphragm. Inferior below, the liver is inferior to the diaphragm. If you don't know where the diaphragm is, well, then that's a problem. But if you know where the heart and the liver is, now you know, hey, the diaphragm's in between there. Cephalic means toward the head. The cephalic end of the embryonic neural tube develops into the brain. Rostral, toward the forehead or nose. The forebrain is rostral to the brainstem. Okay. Caudal, toward the tail or inferior end. The spinal cord is caudal to the brain. And medial, toward the midline of the body. The heart is medial to the lungs. So these are great quiz questions. This is actually very, very important for you to understand medical terminology and directional terms as far as anatomy is concerned. So this is the basis. You need to spend some time on this. Here's some more: lateral, proximal, distal, ipsilateral, contralateral, superficial, and deep. Definitely know this as well. So lateral, again, away from the midline. The eyes are lateral to the nose. Proximal, closer to the point of attachment or origin. The elbow is proximal to the wrist. Distal, further away from the point of attachment or origin. So the fingernails are distal ends of the fingers. Ipsilateral, meaning the same side. So the ipsilateral side. So the liver is ipsilateral to the appendix. The liver is ipsilateral to what? The right lung. Okay. But the liver is contralateral to the stomach and contralateral to the spleen, means it's on the opposite side. So ipsilateral and contralateral, definitely know the meanings of this. And here are some examples. And what you can do is, after seeing this example, if you are quizzing yourself, you say, well, what else is ipsilateral to the liver? What else is contralateral to the spleen? So you understand the concept, because obviously I won't use the same examples in here, but I'll definitely have the same concept. So as long as you understand the concept, then it makes sense. It's kind of like the old saying is, if I fish for you, right, give you the fish, then you can eat for a day, right? But if I teach you how to fish, then you can eat for the rest of your life, all right? So this is the same thing. This is an example, but if you can make your own examples and understand the meaning yourself, then you're good to go. So it doesn't matter what shows up on the test, you'll be able to do that. Now that's the difference between an A and a B, right? If you just do pure memorization, you'll do well for the test and you might pass and you might do it. But if you understand the concept, then that A that you get will carry over to all the other classes that you take during your graduate courses, and you'll make your life so much easier. So really, I can't emphasize how much anatomy, which will form the foundation of your medical career, you really need to take the time on it. If you don't spend the time now, everything else is going to be that much more difficult. Okay? Superficial, closer to the body. The skin is superficial to the muscles. Deep, farther from the body surface. The bones are deep to the muscles. All right. Now we have cavities, right? Dorsal and ventral body cavities. The ventral cavity includes the thoracic and abdominal pelvic cavities and their subdivisions. So if you look at the cranial cavity, well, what do you think is in the cranial cavity? The brain, of course. The thoracic cavity, what do you think is the thoracic cavity? Maybe the heart and lungs. Then you have a diaphragm that separates the thoracic and abdominal cavity. Well, you know what's in the abdominal cavity, right? All the small intestines, the large intestines, the gallbladder, the liver, the stomach, and the pelvic cavity will have your reproductive organs. So understanding what is in what cavity, what organ is in what cavity, is very important. Those are easy test questions. This is a great little image right here, because now you can reference, and you'll see this in the medical chart sometimes, patient has pain in the right hypochondriac region. Patient has pain in the epigastric region. Patient has pain in the left hypochondriac region. So if you know if they have pain in the right hypochondriac region, it could be the liver. If they have pain in the epigastric region, then it could be the gallbladder. Or they say, oh, there's a medical imaging of the epigastric region. Well, then you can see the majority of the liver and the gallbladder is in the epigastric region. Okay. The stomach, it's some of it is in the epigastric, but a large portion is also in the left hypochondriac region. If a patient has pain in the right iliac region, then we can say, oh, that could be their appendix. Okay, because the appendix is found in the right iliac region. In the umbilical region, you've got the majority of your small intestine, large intestine. Left lumbar region, you've got the descending colon. In the right lumbar region, you've got the ascending colon. Okay. In the hypogastric region, you've got the urinary bladder and a small percentage of the small intestine. Or in some patients, large portion of the small intestine. Remember, the small intestine is over 20 feet. You can also break it up into quadrants: right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. So another good quiz question would be, is the gallbladder is found in the right upper quadrant. The stomach is found in the left upper quadrant. The appendix, portion of the small intestine, large intestine, is found in the right lower quadrant. Okay, so making sure that you know which organ is found in which region, also which quadrant, are excellent quiz questions, and something that you should know for the rest of your life. Again, anatomy, I can't stress this enough, is the basis of your medical career. Please take the time to learn this the first time so that everything you take, if I could give you the one advice, if I knew anatomy like I do now, I mean, my career would have been so much easier. You don't have to fiddle around. I mean, anatomy is the basis for everything. So, and anatomy is fun. The more you know about it, the more you can educate your patients, and they'll love you for it. All right, you've got a serous membrane. So you've got these membranes. A serous membrane lines the pericardial cavity that flex back to cover the heart. So a lot of times, we'll talk about these membranes later, but see how this heart fits in this nice little membrane? It's kind of like if you were to put your fist into a balloon, like a deflated balloon. See this little space, airspace? Well, your heart has this nice little pericardial cavity that keeps it safe. Okay, now we'll talk about pericarditis and issues that can occur here, but for right now, you always have to, and here's the key with anatomy, you must learn normal so that you can pick out abnormal. It's a great philosophy, and this is the theme of the semester. Make sure you know normal, so when you see something abnormal, you're like, wait a second, that's not right, right? So that's the way I'm going to teach this class, is I always teach you normal first, and then I'll say, okay, this is what can go wrong. It makes no sense to show you what can go wrong if you never know what is correct. Okay? All right. Well, how do we find out what's wrong with you inside your body? All this stuff, well, we've got to use some medical imaging, and there's lots of medical imaging. I'm sure throughout your life you've already had some medical imaging in your life. Back in the days, they didn't have too many medical imaging, so guess what they had to do? They had to do exploratory surgeries just to see what's going on, and a lot of times patients died from exploratory surgeries. So now obviously we have great technological advances. So we have radiology, which is the branch of medicine concerned with imaging. Invasive, well, that's going to be inserted into the body, and the non-invasive is no penetration of the body. And we'll look at some examples here. So techniques of radiology, radiography, x-ray, or radiograph. Now really the true terminology are x-rays. You really can't see x-rays, right? So you can't say to a patient, did you bring your x-rays? Even though people use that all the time. It really is, did you bring your radiograph or did you bring a film, right? Because the film is what processes the image. So a radiograph or the x-ray films is the proper terminology. But patients will say, oh yeah, I had my x-rays done, here they are. But technically you really can't see x-rays there. So again, but when you're talking to the medical community, it's better to use the words radiographs or films, the x-ray films, because that's truly what they are. The contrast medium for visualization of hollow organs, and we'll talk about why certain things are white versus black versus gray when we talk about x-rays a little bit later on. Okay, and then angiography, we can see blood vessels. So most of the time, why do we use x-rays? Why do we take x-rays? Again, I'm just using the same terminology so we're all on the same page. It's probably to see a broken bone, right? So you probably fell or had your kids fall, because kids are rambunctious and they probably have had their x-rays taken. And you can clearly see if something is broken with a simple x-ray. You can also see if there's fluid in the lungs or something is wrong with the lungs with a simple x-ray, such as TB. We'll talk about tuberculosis a little bit later on. And we'll talk about what each one does. But for most of the time, if we want to see bone, if we want to see a little bit of fluid, x-rays are fine. Now what if we need something more detailed? What if we want to look at meniscus? What if we want to look at ligaments? What if we want to look at muscle? You really can't look at muscle on x-ray, so we're going to have to do maybe a CT scan, maybe an MRI. Let's look at the difference. Well, a CT scan is computed tomography, which is CT scan, cross-section of x-rays. Dynamic Spatial Reconstructor, DSR, a modified CT scanner that produces a 3D video images to show motion and volume changes. So these are great for detecting cancer. Okay, CT scans are great for detecting cancer. The problem with that is the radiation exposure. Radiation exposure on x-rays is very minimal. Okay, but the radiation exposure on CT scans could be the equivalent to hundreds of x-rays. So you want to use this sparingly. You don't want to just order CT scans on all patients. Now, an MRI, which is magnetic resonance imaging, MRI, which is soft tissue visualization. So we can look at the brain, we can look at the eye, but we like to use MRIs for low back, knee, shoulder. We can look at the muscles, we can look at ligaments, we can look at torn menisci, we can look at lots of things. Now, what do you think the radiation exposure is on MRIs? Go ahead and mention that in the chat. What do you think? Do you think the radiation exposure on MRIs is high, low, or none? Well, if you picked none, you are correct. There is no radiation exposure on the MRI because it uses magnets. So MRIs are one of the safest medical imaging that you can do. You can have an MRI every single day if you want to. It costs you a lot, but there's no real radiation exposure here. So those are relatively safe. Now, just make sure you don't have anything magnetic when you're going into the MRI. Usually the tech should be good, but you won't believe it. One time, someone in the MRI, they forgot to take the oxygen tank out of the room. The patient was on oxygen, but they left the oxygen tank in the corner thinking, okay, as soon as they turn on the MRI, the oxygen tank, which is metal, got sucked towards the MRI machine and hit the patient in the head and killed the patient. Okay, so errors can occur, but don't make those silly mistakes. Okay, you have to understand what is at work. How does a machine work? How does the body work? Okay, and what is the reason that we're doing something? Again, it goes back to the concept. Understand why you're doing something versus just doing it, and you'll be that much safer. And then PET, positron emission tomography, PET scan, gamma ray detection, nuclear medicine, it uses radioisotopes, so PET scan, high radiation as well. Okay, so here's a PET scan of the normal brain, and then here's a PET scan of the Alzheimer's disease brain. Okay, so a big difference right here is if you look at the heat map here. So again, radiation, high radiation in PET scans, high radiation in CT scans, minimal radiation in X-rays, and zero radiation in MRIs. Sonography, which is reflection of ultrasound waves, relatively safe. Use a sonography for our OB. You can look at your little baby. Echocardiogram, beating heart, you can look at that. Okay, so these are all safe. So here are some, here is an MRI machine. Okay, so here's the magnet. Results of a CT scan of the head are shown in successive transverse. An MRI machine generates a magnetic field around the patient, so that's an MRI machine. Here is a CT scan. Here is a PET scan. PET scans use radiopharmaceuticals to create images of active blood flow and physiological activity of the organ or organs being targeted. Sometimes they can order a PET scan to search for cancer. Okay? And then ultrasound technology is used to monitor pregnancies because it is the least invasive of imaging techniques and uses no electromagnetic radiation. Okay? So it's very safe for the baby and the mother. All right, excellent work. Not bad. We're done with chapter 1 here. All right.